Okay, dear students, today we'll be talking about dysphagia. As you must already be knowing that dysphagia is a swallowing disorder. So these are certain challenges that you may come across while you are trying to swallow something. So during this lecture, we'll be talking about what dysphagia is it, and how it can be classified, and what are the characteristics that point out to a condition that's dysphagia, how do you identify it, and how do you treat it. So in the earlier section, we have got some simple definitions, which states that it is an impairment in the ability to swallow. So remember, impairment is something that can be reversed. So impairments, if managed properly, can be reversed. So unfortunately, at times, an impairment disables you to make the bolus go into the food pipe. So this might be one of the reasons that can lead to dysphagia. So why does it happen? We need to understand that there can be some neurological or structural problems. So neurological, as you know, every movement is coordinated by your nervous system. So at times the nervous system is compromised one way or the other for one reason or another, or there is some structural deformity, or there is some structural change in the case of pathology that is going to prohibit you to conduct the normal swallowing maneuver. ASHA, American Speech and Hearing Association, has added this as a role of speech language therapists and pathologists so that they can manage the speech language disorders along with the swallowing conditions that arise from a number of reasons. So it's quite busy clinic actually. Dysphagia clinic is a busy clinic because you tend to support the people with some extended exercises, maneuvers, food manipulations. So that's why it's a long session. And besides, the number of people, the number of population suffering from dysphagia due to neurological conditions and developmental factors. Yes, you must understand that there can be children who have got swallowing disorders. So while it is in the part of development, we call it as a developing factors. For example, consider a child with cerebral palsy. If he do not have muscular controls, so he certainly will have issues with swallowing. Just imagine a child with cleft palate, a child with oral motor dysfunctions. So all these things are going to affect the swallowing factor. We must understand why swallowing is important. Swallowing is important because it is going to assure that you have got enough nutrition and hydration that is important for your survival. So, besides the important role of oral motor structures in producing speech, one very important factor is that it helps you get the nutrition and hydration, which is mandatory for your physical growth. So that is why we do consider it as a domain of speech language pathology, since it has to do with the structures that are responsible for speech as well. So moving ahead. So these are some cases that I would like you to understand, since this is going to give you a brief overview what I'm talking about. Just imagine, uh, while we go through this case study, you will certainly realize what are the reasons behind dysphagia. You will certainly appreciate what can be done. You will certainly appreciate what are the symptoms. So just let's go through this slide. So in this case study of Sylvia, she is a 78 years old Alzheimer's dementia living in nursing home. Now, this is a very important information. Look at the age, 78 years. Look at the condition, Alzheimer's. Look at the condition, dementia. And she is living in a nursing home. So these three factors you must keep in mind. So one is age, number two is any neurological debilitating disease, like for example, in this case is Alzheimer's and dementia. And the third thing is that she is living in a nursing home. Now, why in a nursing home? Because of her age, because of her physical ailments. And the third thing is that certainly she is now not more active now, and she has to be nursed throughout the day. But this Sylvia actually needs a minimal to moderate assistance. Now, this is again a very important information. So there can be people who have got dysphagia, but they need only minimal assistance. And there will be patients who will be needing maximum assistance. Because swallowing is something that can, if not appropriate, can lead to factors that can cause pneumonia. And pneumonia actually is one condition that can have a disastrous end. So we need to understand out of these three lines that it is the age, it is the mental condition, it is the way of your lifestyle, and finally, these three lines indicate that people have got varied needs in terms of assistance. For example, some might need just a little support, and some might need an extensive support. For example, again, somebody can benefit by just improving their postures, and some of them will be required to be given a food which is manipulated for them, that is made for the purpose that it facilitates swallowing. So these are all minimal and extensive kind of supports that are required. Now, the next three lines. How did somebody realize that she has got swallowing disorder? Now, there are certain indicators. For example, she was not finishing her meals. So this is one very important finding, that if somebody is not finishing his meal, number one, number two, he's not enjoying his food, number three, he has a gurgly or wet voice, again, very important finding, and number four is coughing episodes. Now, as we proceed in this lecture, we will realize that finishing meals and gurgly voice and coughing episode, these are all indicators that is a suspect that the person is not enjoying the food, or the person is not confident to swallow it, or he is not safely swallowing. So remember, swallowing is about safety. So what our role as speech therapists is to ensure that the person not only swallows, but we ensure safe swallowing, because otherwise it is going to have its consequences. So speech language therapist, out of this information, in this case study, realized that the person has got pharyngeal stage swallowing and wants a further instrumental assessment at local hospital. Now, what these three lines tell you? These three lines indicate that there is a stage which is called pharyngeal stage. So in swallowing, we come across four different stages, but in case of Sylvia, it is expected that she has got pharyngeal stage of dysphagia. Likewise, these three lines indicate of instrumental assessments. So here we need to learn that assessments can be instrumental, and assessments can be observational. So at times we do depend upon instruments to find out that what's going to happen to the food, to the bolus, how does it travel in the food pipe. So for that, a naked eye cannot see it. So we need to dwell upon the technology of X-ray, through which we can actually determine how the food is behaving while it is in the oral cavity or in the food pipe. So out of these few lines, we understood that age matters, nervous system, the condition of nervous system matters, your lifestyle matters. There are some observations like not finishing meals, for example, coughing, for example, gurgly voice, etc., etc. Now, these are observations. And finally, observations need to be convincingly understood with the help of some instrumental assessment, which we'll be talking later in this lecture. Now, there were certain conditions which were observed and which were actually felt by the practitioners, that how to transport Sylvia to a local hospital. Now, since Sylvia was 78 and she has to travel from her living area to the hospital, and for this, it's quite a procedure. So we need to understand that it is going to be costly. So one issue, number one. Number two, how might reliance on other assistance with feeding influence nutrition status and hydration? Is there an other way that we can rely upon nutritional values and hydration? Can we improve her nutrition by switching on to a better diet, to a different diet? For example, if she's not eating enough, let's change the food to be of a quality that can hydrate and nourish her by simplest procedures, by simply taking food that is more nutritious and it has more hydration in it. So these can be certain questions that may arise. Now keep these things in mind and let's take another case. This is about Lee. Now Lee is 43 years old. The earlier one, Sylvia, was 78. This is 43. So I'm referring to that earlier patient was an old one. He was a geriatric patient. And this 43 is an adult. Now, not only that, he is 43, he is a bilingual man. Now, why bilingual? What does bilingual mean? Bilingual means he is using two different languages. So there might be some communication concerns as well in terms of his vocabulary, reception, etc., etc. And his swallowing challenges arise because of a cancerous condition of the right buccal space. So within the oral cavity on the right side and the buccals, Lee developed carcinoma or cancer. As a result, his oral volume or his oral cavity is actually narrowed, number one, and must imagine the pain that cancer causes. So number one, it is the oral cavity where the food has to be manipulated, it has to be chewed, it has to be lubricated. But for this cancerous part, just imagine he will not be able to use his right side at all, number one. And just imagine the sort of pain that he feels. So eating is not a pleasant experience for him anymore. So he will certainly refuse to eat because the moment he moves his oral cavity and his teeth and gums, the excruciating pain is going to affect him. So he might develop a fear of eating and might refuse to eat. And as a result, what will happen? His nutritional values, his hydration values are going to get down and, of course, will affect his quality of life. Now, there is one more important thing. To treat the cancer, Lee had radiation therapy and neck dissection. Now, not only the cancer has to be removed somehow. So they did it, and now he has to go for radiations. Now, radiation itself has its own issues. So it might affect your taste buds. It certainly affects your hair. It certainly affects your eating behaviors. So besides cancer and the pain, the person is also being exposed to X-ray, to these high radiations, which are going to affect the normal metabolism. Currently exhibits pharyngeal dysphagia, aspiration, hoarse quality voice, hoarse vocal quality, and right lower facial weakness. Now just imagine. Now what these three lines indicate you? The earlier one, while we were talking about Sylvia, she had pharyngeal dysphagia. Lee also has pharyngeal dysphagia. So we tend to understand, okay, one phase is pharyngeal dysphagia. Number two, aspiration. As told you previously before, uh, aspiration is something penetrating below the vocal cords is aspiration. So usually, as we swallow, nothing goes uh, below the vocal cords. But in cases where the physiology is compromised, the food might travel into the windpipe, causing aspiration. The next thing is hoarse vocal quality. Now, hoarse vocal quality is another indicator that vocal cords are inflamed. Why are they inflamed? They can be inflamed of number of reasons, but in this case, it seems that the radiations or the medication has somehow affected his vocal quality by affecting his vocal cords, which added to the hoarseness of his voice, and right lower facial weakness. And as a result of the surgery, the patient is reporting lower facial weakness. Now, in all, if you understand, this is something very obvious and tricky actually, because primarily the patient was not willing to eat because of the pain. Then the surgery process was done, and now he has developed weakness and vocal cords inflammation, and and the facial muscles have grown weaker. Now these facial muscles certainly have a role to play while in chewing and swallowing. So once your muscles are compromised, you will certainly have challenges. And the third thing, which again in the last line you can see, it says the patient has started receiving nutrition through G tube. Now there's more information for you. Now there is a word G tube. So G tube stands for gastrotube. So at times when a person cannot sufficiently or safely take food from his oral cavity to the stomach, so we need to find an alternate route for the food to go to stomach. So in this case, in the case of Lee, what we did was he was advised G tube, where the food is directly pumped into the stomach. Now, why are we doing it? We are doing it to make it safe for him to be nutritioned and hydrated. Because if we follow the normal physiology from the oral cavity to the food pipe and into the stomach, that has its consequences because he was already aspiring. He cannot safely swallow. And this unsafe swallow is certainly going to affect his life anyways. So in order to prevent any sort of disaster like this, what we did was we suggested him a G tube. So G tube is one option for patients where there is no hope, or where there are less chances, uh, where there are less chances to safely execute the swallowing. So G tube is inserted in the stomach by through a process, through a small surgery, with which an opening is created in the stomach, and food is injected through food injections, and the food directly is transported to the stomach, where it is, of course, digested, and the process of digestion starts. So remember, there was no problem with his digestion. The problem was food reaching the stomach safely. So in order to avoid all these hazards, what we did was we advised him a G tube. And so out of this small information, you realize even an adult can have swallowing disorders, but in this case, the person didn't have the problem of neurology, but the problem of oral cavity, because the oral structures, they couldn't function, they couldn't chew, they caused pain, their oral volume was reduced, uh, and safe swallowing was compromised. As a result, we put him to G tube, which consequently may be removed at a later stage when Lee develops uh, abilities in his oral cavity, as his pains and his neck weakness, right lower facial weakness improves as a result of exercises and nutrition. Certainly, we will remove the G tube and move back to the normal physiological swallowing through oral cavity. So this might take a while, since it depends upon the condition, the age, uh, and the sort of treatment that the person is getting. So this is very important information for you. So I'm just trying to share a brief picture of the patients to you, so that you can realize that dysphagia not only can affect the elderly, it can affect adults as well. So now Lee was just 43, and the reason was in a cancerous vector. So some questions: is Lee a candidate for dysphagia therapy at this time? Should we give him the dysphagia therapy with his cancer and with his weakness of facial muscles and with aspiration? So the answer is no, because it is certainly risky, because cancers have a growth pattern which cannot be controlled. So our any attempt like this is going to affect the cancer stage. So, and the pain, of course. So let's move to the safer side, and the safe side is, let's move to G tube, because this is too much of a labor and expectation from Lee. So put him to a place where he doesn't have the problem of nutrition or hydration, and the professionals can thoroughly treat his more debilitating condition of cancer. So to be on the safe side, so we move to the G tube. So what education should be provided to Lee regarding this? We need to tell Lee that it's all right. This G tube is not forever. As you improve, you certainly will benefit. You certainly will benefit in your radiation therapies, etc., etc. We'll give you exercises. We'll do oral motor physiological uh, stimulations. As a result, as you improve, you will get rid of this G tube. This is not permanent. This is going to help you overcome the pain experience that you get while you eat. So an interesting little case was Lee. So so far we have talked about Sylvia and Lee. So one was 78, one was 40. Both of them have got pharyngeal swallow. Lee was aspirating while Sylvia was just eating less, number one. Both of them have got gurgly voices. Both of them have unpleasant experiences. They were not enjoying food, but the management is rather different. So in this case, we move to G tube, while in the case of Sylvia, we still need to do instrumental evaluations to see if we can do the postural things, if we can do the food manipulation program, etc. So let's move on to the next case. The next case is Martin, again 45, and has got Alzheimer's, ALS, 18 months ago. Uh, he has been on a puree diet. So we have got new information that there can be different types of diets, and one type of diet is called puree diet. So we'll talk about it. Just keep it in mind. So one is regular diet, one is puree diet. So number one, loss of weight is one significant factor which indicates that the person is not eating well. So 15 pounds in 2 months, this is a very extensive loss of weight, and this might be referring to uh, following issues. And just recovered from severe aspiration pneumonia. As told you, if you are not doing safe swallowing, certainly you'll get pneumonia. One more word for you, MBS, modified barium swallow. Now, this is one instrumental evaluation that we were talking about. So MBS is one way of assessing what's happening to the food. And this can actually indicate where the swallowing problem is. Is it a problem in the oral cavity? Is it the problem in the pharyngeal cavity? Or is it a problem of esophageal region? So we need to understand that MBS is again one instrumental way where we can study this. Martin and his family now need to decide whether or not to resort to feeding tube. Well, there's another word. Earlier we talked about G tube. Now this is feeding tube. So what is a feeding tube? A tube inserted through the nose, pass down your food pipe into the food pipe. So the food is again pumped in through this tube towards the stomach, and why are we doing it? To ensure that he doesn't aspire, to ensure that he is not eating enough, and we need to give him hydration and nutrition. So since he was finding it difficult to chew and swallow, we are trying to help him that he gets proper nutrition for nutrition and hydration, and avoid pneumonia as much as possible. So it's a big decision. Should we go for a feeding tube? Should we go for a G tube? Because the consent of the patient is important. And here again, uh, this is what Martin's family is confronted with. So at times people have got beliefs. They'll call, okay, this is not human. I'll be feeded with a tube. Is it religious? Is it not? So there are many issues to any individual patient. So we need to consider that in mind, and we need to consult the patient before this is done. So consent seeking is an important element when it comes to dysphagia and its management. So we be very sure about it. Finally, there are some questions. As a speech language pathologist, what are your responsibilities to the client and his family in making the decision? We need to counsel them. We need to tell them about why do we need to move to NG tube. This is also called nasogastric tube. Now, nasogastric tube is a tube which will be replaced, which will be taken out as you progress, as you improve. We need to counsel. This is not a permanent thing. So this might look a bit odd. It will not, of course, you won't have the taste of food, etc. Since you are passing by the food texture that is felt and taste felt by your tongue. So you are actually avoiding oral regions. So you might not get taste, but as you improve, it will be all right. And what support should be provided to the family during this decision making? We need to counsel them again. Supports, we can share them with cases, we can show them videos, we can show them how the patients have responded, we can show them case histories like Martin, so that they can have an easy decision making. So with this, I conclude today's lecture. I'll be happy to answer any questions. You can send comments, and you can certainly you can certainly refer to any of this case, and I can talk more in detail. So with this, we conclude our today's session. So and let's get back to the topic of dysphagia in the next class. So for the time being, it's all over from my side. Thank you.